Thanks a lot, Chris. February is American Heart Month. Heart disease is one of the leading killers in the U.S. Cardiologist Craig Walker of Terrebonne General Medical Center is here to talk about heart health. Good morning.
Hi.
How you doing?
Fine.
How's your heart doing? Tell me about heart disease in general. How common is it for people under age 60?
Sure, it's a very common disease. Almost any ward of a hospital, it's the #1 cause of death. And in America, it's overwhelmingly the #1 cause of death. Heart disease is 1, cancer is 2nd, stroke is 3rd. And stroke is also related to cardiovascular disease. So it's a huge problem across the board.
Because most people will probably tend to think that it's cancer that's #1, but it's heart disease.
That's right, particularly women. Women have historically thought themselves immune to heart disease, and in the past they weren't as apt to get heart disease. But now it's easily the #1 killer of women. It kills as many women as men at this point in time, and it's a huge problem. We have days devoted to simply breast cancer. Well, heart disease by itself trumps how many women die of breast cancer by many, many, many times.
Now, I think that's going to be surprising to many simply because you hear so much about the other. So what changes to diet and lifestyle can we talk about that can help people trying to avert it or cope with it?
Sure. Obviously, there are 5 known risk factors from the past. They include family history, can't do anything about that, cigarette smoking, which we can, abnormal blood fats, which we can do a lot with diet and with medications, high blood pressure, which we can certainly treat and control, and diabetes.
And what is some of the advanced technology that will help with those diagnoses?
Sure. Well, I think right now we know that this is a buildup of plaque. There's inflammation that occurs, clot occurs. And first and foremost, if someone has risk factors, they should be evaluated. We have more sophisticated means of evaluation now. We have better blood tests that pick up inflammatory markers that can really break down how likely your blood is to want to deposit cholesterol. We have tests like calcium scores where people can actually lay in a CT machine and have about the same x-ray, chest x-ray, which is very low, and determine if they even have early atherosclerosis. Of course, we have standard tests, electrocardiograms, treadmill tests, echoes. But I think that the most important thing is for everyone to realize this is the leading killer. It's the thing most likely to kill most Americans. If you have a family history or risk factors, it's important to be evaluated and to try to change those risks.
What are the symptoms?
Well, most people with cardiovascular disease have no symptoms at all. And it's not until it's very advanced that anyone really feels symptoms.
That's scary, but it takes a while before you really know.
And in many patients, the very first sign is a killer heart attack. And so that's why it's so important to think of this preemptively. The best treatment for heart disease is to prevent it. Second best is to diagnose it early, and if you haven't done those things, to make sure you get great care with advanced modalities that now exist. But prevention remains the key. And the best thing that one can do with a family history or who smoked or who has diabetes is to see someone, get evaluated, and find out if indeed they're on the path to developing atherosclerotic disease.
So while it's unfortunate you don't see the early symptoms until sometimes it's too late, if in that moment a loved one or yourself you're experiencing or get like seconds away from a heart attack, what are those symptoms?
Sure. Chest discomfort. The most classical sign is what we call angina, which is an ancient Greek word meaning squeezing. And one feels a fullness or squeezing in the chest, but sometimes it can be burning chest discomfort, indigestion, shortness of breath, passing out or syncope, pain in the arms, pain in the jaw. Any of those can be signs of a heart attack or signs of an impending heart attack.
Well, thank you so much for coming in. Some important tip, especially if it runs in your family, to get checked out.
Absolutely. Thank you so much.
Thank you.